Sepsis is a medical emergency, not just a complication of an infection. Sepsis happens when our body loses control of its own immune response while trying to fight infection. That small boil you have around your armpit that you have been ignoring, or maybe you have around any part of your body, or that cut you have been cleaning with surgical spirit or mentholated spirit, that particular wound that you have been cleaning for years with mentholated spirit, or maybe that's malaria, that fever that you have been calling malaria. Those are the stories doctors normally hear before they say it's sepsis, and many a times it may be already too late. Now today, let's talk about sepsis. What really is sepsis? How does sepsis develop? I know you have been hearing the word sepsis. I might be wondering, what exactly is it? Don't worry. In today's video, I'll be diving deep on what sepsis is and how this actually happens, how it develops. And if you're new here, you're so welcome. Do wait to hit the subscribe button so that you'll be notified anytime I post a new video. My name is Untreated and I'm a clinical physiologist. In this channel, we break down health topics, making it easier for you to understand. Now let's dive into the subject matter today, sepsis. So what exactly is sepsis? You see, sepsis is a medical emergency, not just a complication of an infection. Sepsis happens when our body loses control of its own immune response while trying to fight infection. Normally, when viruses, bacteria, or even fungi enters into our body, our immune system responds in a targeted way. Then the white blood cells helps to attack these bacteria, these viruses, and it releases chemical messenger called inflammatory mediator or even cytokines, which helps to contain this infection. But in sepsis, that immune response becomes excessive and widespread. Instead of staying focused on the infected areas, the immune system releases this chemical, that's cytokines and inflammatory mediators, throughout the bloodstream. This causes systemic inflammation, meaning that the whole body becomes inflamed at once. The immune system releases chemicals called cytokines to fight infection. But what happens is that these chemicals are helpful in small amounts, but in sepsis they are released in excess. Instead of helping to cure the infection or to fight infection, they start harming our organs, our system. And as a result of this, blood vessels begins to dilate and begins to open and start to leak fluids. Blood pressure drops and blood no longer flows properly to vital organs. And that is when organs like your kidney, your heart, your brain, your lungs begins to struggle. The kidney may stop to produce urine while the lungs may find it hard to exchange oxygen. And as a result of this, the brain loses consciousness due to lack of oxygen. And if nothing is done quickly, if this process continues, it can result to septic shock. In septic shock, blood pressure drops dangerously, even with fluid. Oxygen can't reach organs, and at that point, survival becomes much more difficult. That is why doctors treat sepsis as a race against time. The earlier treatment starts, the better the chances of survival. Now, the most annoying thing about sepsis is that sepsis does not come from anything dramatic. It starts from common infection, things that people deal with every day. Sepsis can start from a lungs infection like pneumonia, untreated UTI, untreated urinary tract infection, or maybe if you have a wound or a cut that is infected and you left it untreated. It could even be a small boil on your skin that doesn't make sense, or maybe an abscess. Now, when all these are left untreated and the germs begins to enter into your bloodstream, the body starts to panic. Now, once these germs enters the blood, the immune system reacts immediately and produces powerful chemicals called cytokines. So what makes sepsis dangerous and deadly? It's not just the infection itself, but the chain reaction it actually triggers. These chain reactions can actually cause uncontrolled inflammation due to overreactive immune response, poor blood flow, low oxygen delivery, and eventually organ failure. Now listen carefully, sepsis don't always start in a dramatic way. Sometimes it starts bit by bit, quietly. Now, if you notice symptoms like uncontrolled fever that refuses to stop, or maybe a temperature that is lower than normal, or you notice your heart starts racing, your heart rate increases, or maybe difficulty breathing. Some persons may feel extremely weak. If you find yourself in that condition, rush immediately to the hospital. Stop treating malaria and typhoid. Rush immediately. It is a medical emergency. Let the doctor check you, particularly if you can't breathe properly. The key thing to remember is that if you have any infection at all, whether that infection is small or big, do not overlook it. If you experience any of the symptoms I have mentioned now, and you have infection that maybe has been there for months, weeks, or even days, or maybe years, notice any of these symptoms I have mentioned, rush to the hospital immediately. Sepsis is a race against time, and if it's caught earlier, it can be treated. I hope this video is very helpful. Let's stop risking our life. Don't forget to like, share, and subscribe. Bye.